actually for patiently waiting and participating. I know this is going to must be tiring given this is the last session, but believe you me, this is the most interesting panel, at least personally, given very fascinating aspect that, how tech for good, tech for humanity, and tech for healthcare is a great example and a very hopeful scenario for us as humanity in terms of how do we leverage some technology for the benefit of the society. And that's where I think I've got this esteemed panelist with us, and really thankful for ETTelecom to kind of host us and give us an opportunity to share our opinions. There's a whole body of fantastic work that is being done by these gentlemen on the dais today. So would be very keen to get your perspective. We have Kausar over here who has to leave early, so maybe I'll start off with you, Kausar, if that's okay with the rest of the panelists. I think we've seen great adoption of 5G for healthcare. We've recently, in January, I think you all must be aware of the robotic surgery that happened from Orlando to Dubai. I think that is a great example of how 5G can be used for healthcare. I think, Kausar, it will be great to have your perspective on how do we see some of these innovative use cases in healthcare being deployed in India through 5G. Is robotic surgery a reality for India as well?
Thanks, Sonika. So before I start, let me tell all the audience that I believe in AI. And I can sense most of the people sitting here through the AI are half asleep. So it's better to get up, guys. We'll have some interesting discussion with all of you. So anyway, so that was on a lighter side. Coming to the question which Sonika, which you have put up. In fact, robotic surgery has already seen a tremendous movement from what it used to be till about 3 years back. So I recall an incident where one of my surgeons told me that there is a patient who needs a surgery. And so I said, what is the issue? So they said they just want to understand some hospital's infrastructure and the technologies and all that available with you. So can you put up somebody to speak to the patient so that we can talk to the patient, what do they require for coming over back to us only, because I have seen the patient myself. So I told one of my staffs that please get in touch with the patient, understand what do they require in case we can offer, let's see to it, because anyway patient requires the treatment. So my staff which spoke to the patient gave a very interesting perspective, which talks about that we are migrating towards technology very, very fast. So the guy told me who spoke to the patient, sir, I spoke to the patient. The patient told me the doctor who has advised surgery does not do robotic surgery, but I want robotic surgery. So I said, didn't you say that we have other doctors available who do robotic surgery, but that will be at a little higher payout? So the patient said, I'm okay with that, but I want robotic surgery. This actually made me think, this is not a very long incident, just about 7 to 8 months back. My perception also changed in terms of people opting for robotic surgery or not opting for robotic surgery, because till that particular time, even I used to be thinking, because robotic is on a little higher price compared to the normal or conventional way of surgery. But I was surprised that the patient herself is asking, I am ready to pay higher, but I want only the robotic surgery to be done, not the conventional way. This really told me that we have arrived in an era where the future is going to be more technologically, soundly, well-driven future. And just about in recent times only, we have seen the first heart transplant in our country happening through the robotic, which again speaks about the way in which the things are going to happen in future. So I think we are at the threshold of turning into far, far, far more technologically advanced as a country. But the point is, which I always make in wherever I'm there as a speaker, we need to understand that we as a country are poised at a different platform. In the sense, 70% of our population is living in the far off areas, village areas, or non-urban areas. How do we reach there? All the advancements that are happening in the metros or the bigger cities, tier 1 cities. But the reality between what is happening in the majority of our country is far, far, far different than what we are facing and living and seeing around us. Again, I will quote from my own experience. About a year back, one of my colleagues' father had expired, and he stays little on the outskirts of Gurgaon area, which is about, 30 kilometers from the proper Gurgaon. So me and my colleagues were going there. When we reached the place, and then we were just looking around, we were aghast to see this place, which is just about 30 kilometers away from the hub of the medical, I can say the technologically most advanced place, which is Gurgaon. It looks like the basic medical amenities cannot be availed there. And when we spoke to some of the people, they said, absolutely, you are right. We are only relying on the wrong type of doctors which are seated. They're not qualified doctors. They're just giving something or the other in the name of a treatment. So the difference between traveling just about 70 to 40 kilometers outside NCR region or any metro for that matter is far, far, far away from the reality, what we see in the metros or what we see in the tier 1 cities happening. I think that is where the technologies must start focusing upon. They need to focus at connecting these far off areas, if not in manual way, at least technologically, to the hub, which are the main metros or the tier 1 cities. That's where I believe the real transition in our country will come. So that is a stage, I think, which I think some of the companies and some policies of our country also have identified. 2030 to be the year which should be technologically most savvy year for healthcare. Let's see how far we become and how far we reach there. But I think this is really far away from the reality as of now. But yes, movement is happening.
Thank you. This is great. These are great insights. But you talked about the technologically connecting the country. Are there any specific steps in terms of, that you as an organization are taking, to kind of deploy some of these, we're talking about IoT governing the industry. Similarly, we're talking about IoMT governing the healthcare and taking over healthcare, perhaps by 2030, as you're saying. What are the critical initiatives that you as an organization are taking to kind of be moving in that direction?
So again, just at the healthcare level, I don't think, or at the organization level, this is something which can be done because this is a whole lot of technological connection which is required. So for example, 5G, if we see 5G is extremely low on patency. That's why the delay in transition is very low. But that also has some large amount of technological requirement, which is not there in healthcare, if I have to say as a healthcare leader or a hospital head. I don't have the bandwidth to handle that. I need support from the people who are actually doing this. Now, for example, when the transition of the image has to be sent to some other place through 5G, it works at a very, very high frequency, which again, not something which I can do anything about. For that, you will be facing a lot of, in terms of frequency, there will be a lot of disablement which will be happening. And for that particular reason, you need a very, very strong technologically sound base from where it is being transitioned. At the same time, where it is getting received, there also you need to be having absolutely sound technology, high-level technology, which again, as a healthcare vertical, as of today, we are not really tuned towards that. We are looking up to the various telecommunication companies, which may provide some help on that, but definitely that is a need. And as of now, we are only maybe in the little surroundings like video calling also, that's what we are doing at the name of telemedicine. But yes, future has to be AI driven, where the AI must get connected through the IoMT. But the movement from IoT to IoMT is, again, not an easy task because there is a lot of human intervention required.
And precision.
Absolutely right. So that human intervention which cannot be taken away from healthcare is what we need to be looking at from real development perspective, which currently is the task, is the challenge. But yes, the work is being done, specifically from the companies, the telecommunication companies and the technologically advancement type of companies. And healthcare is ready to be parting with that, but healthcare itself cannot drive it. We can just be part to it.
Thank you so much. Kausar, I know you need to leave, so please feel free to kind of step down whenever you want.
I would right now itself then. Yes.
That's fine.
Thank you.
That's fine.
Thank you. Thank you. Thank you. Thank you. Thank you. Thank you.
Yeah. Thank you. Thank you. Continuing with the flow, Mr. Bharadwaj, we just heard Kausar talking about some of these interventions that we need to kind of proliferate the tech for good that we talking about beyond the tier 1. So how do you see, I mean, government I think has been very supportive, has been very forward-looking in terms of bringing in and enabling an ecosystem that has made all of this possible. So, but how do we take it forward now to the rural areas, and what is the government's thinking on 5G for healthcare?
Sonika, this question has two parts to it. A is how do we connect the unconnected, if I may use the term. How do we provide that ubiquitous, digital connectivity across regions, which some of them are really sparsely populated. So there are programs, and there are active running programs, and if I may talk of outlay, it's a big number. Almost 100,000 crore is being spent over a period of 7 years, where we are connecting all block headquarters, far-flung areas using fiber, because you need, it's not about last mile connecting through mobile, you need the backhaul. If you need to perform robotic surgery with the kind of latency we are talking, you need very, very high speed backhauls. So that those highways are being laid. We have, as we speak, less than 100,000 villages out of 648,000 villages, which are now not connected. Otherwise, whatever is the geography, whatever is the amount of population and business case, these are the areas where business case doesn't justify laying of the fiber. So government is doing that. The second part is even what to speak of fiber. Fiber is, I mean, laying fiber is a capital intensive work, but even a mobile tower, the business case is not justified. So as we speak, we are putting 20,000 mobile towers across 5 far-flung area. We call it 4G saturation project. This year, the capital outlay for that, and it will finish, we expect it to finish by 31st December, maybe some spillover of 15-20 days. But by the end of this year, across India, either a village will have a mobile connectivity, 4G data intensive, 4G saturation project connectivity, else we will connect that village through a satellite and we'll pay for that. Government will pay for that. So the word we call is ubiquitous digital connectivity. It has to happen, there is no choice. We cannot, the way we talk of financial inclusion, we are talking of digital inclusion here. So no Indian citizen will be outside the ambit of that. That is the A part of your question. And if I talk of B part of question, that there comes, how does it help healthcare? We are building these pathways, and if I may tell you, the 75% of users in initial year when we provide connectivity is on entertainment. People start downloading videos, people start making reels. But we say at least they are becoming digitally literate. They are learning how to use these devices. They're learning how to use apps. That's the first way. If they become, this device, it's not so friendly, it is friendly to me. It is not so friendly to someone who has not used it. So that is the stage one. But in terms of funding of the projects, DoT itself has come out with a scheme where we call it 5G Internet Ready Village. We call them, and as we speak, different associations, our telecom related associations have been assigned. They have, each one of them have adopted 5 villages, and the use cases they are building actually span between healthcare, education, and agriculture. So they are building the use cases. Now what happens, once you have the highway available, you have to build these use cases. And India is very, very special. Our use case, our way of using technology and the use case of the other parts of the world are very, very different. You know, with UPI, what we have done, nobody could have imagined, because we required this kind of a thing that you go to a tapri, buy a tea, and are able to pay 10 rupees without any overheads. Okay, so the way we built UPI, which is a big success story or an example, we are trying to create use cases and across department, and I am speaking this not only on behalf of Department of Telecommunication, across Department of Science and Technology, Ministry of Information and Electronics, they are all through their STPI program, and many state governments, they are funding startup like by paying them grants. We are not even seeking equity. We are saying, come, explain the use case, we will throw a grant at you, build the use case, because we know these are the use cases which will champion the healthcare or the education or the agriculture for the benefit of citizens tomorrow. So all that is happening, and I can go on in explaining some of the programs, but maybe after a few minutes.
This is really encouraging, Mr. Bharadwaj. I mean, I think some of the impetus that government can provide in connecting the unconnected, I don't think the private industry can. And it's really heartening to see the vision that you have in terms of connecting the rural villages. With that promise that technology and connectivity is going to be ubiquitous, Mr. Dwivedi, wanted to get your perspective on how is AI transforming healthcare? You know, we've seen a lot of medical LLMs being developed, which are being focused to kind of help in clinical decision making. Is that for real? How are we seeing the adoption in practice?
Life has changed 360 degree.
Clearly.
So I'll tell you a few perspectives, starting with robotic surgery only. So one very basic advantage of robotic surgery is that for sure it reduces the blood loss and A loss. So A loss is average length of stay in the hospital. This is for sure, but there are precision elements, you know, certain organs where surgeon's knife cannot reach, robotic arm will reach. So it makes surgery much more precise, much more effective. Coming back to how AI is helping. From patient's perspective, there are 4 different segments that really patient looks for in terms of value addition. Very first is patient safety. So patient expects, I am coming to hospital walking in, please let me walk back home. No, don't kill me because of your errors or surgical site error or hospital acquired infection. Second is the clinical outcome, the reason that patient came for, the at least proper diagnosis and treatment happens. Third is cost reduction, reduce the cost, that is monetary outflow. And fourth is patient experience. So I don't expect to be treated like a king, but at least minimize my discomfort to whatever level possible. In all these 4 areas, AI is actually playing a tremendous role. So starting with the patient safety, you see, AI has all the built-in mechanisms. When doctor is looking at the patient, AI will tell, by the way, doctor, this much dose may be little too much for this patient. And these are 25 use cases, 25 case studies that are similar to this patient's situation. And that creates basically a clinician decision support system. In diagnosis, so in terms of, you know, when patient comes for diagnosis stable, 20 different types of tests were required just to corroborate. Now, with advantage of having radiomics, advantage of having digital pathology, all converging together, probably one test will tell, and it will reveal all that information that you were trying to obtain by the cross-section of different, take prostate cancer as a case. The multi-parameter MRI happens, and at the scale of 1 to 5, if scale it is PIRAD 1 or 2, it is basically probably benign. So the surgeon will leave it. Third will be the indecisive. Fourth and fifth are probably malignant. So in case of third, it is a possibility that the tumor is benign or it may be malignant. Now with the traditional method, the prostate has to be punctured. Biopsy has to be taken, and only then the microscopic examination will reveal. But if you are having digital pathology and you are running AI engine on top of it, it will tell just by having a small fine needle aspiration. So there are a lot of ways that help in minimizing the discomfort of the patient and minimizing the cost also. Now coming to experience, patient walks inside the OPD, now has to go to the blood sample collection area, radiology area, pathology area. Now there is a navigation screen application. Just on the patient's mobile, I see patient asking the guards and the ward boys and everyone. There is no need. That AI is helping, navigating the patients. Taking the vital parameters. Patient is lying on the bed. There is a smart sheet beneath the bed that is constantly monitoring the parameters. And in case something goes wrong, the nursing station is alerted. That is happening in our hospital. Last month, our head of the neurosurgery, he conducted tele-robotic surgery while he was sitting in Gurgaon, and the surgery was happening in our hospital. So we did that and we proved that happening. So these things are very much in there. Now you see how all these things are happening, why technology is so vital to the patient care. There are three different elements. One is the patient, other is the hospital, third is the doctor. Now all the three need to be together at the same place in order to deliver an effective care. But if we have a 5G technology, they need not be together. A lot of things can be done while patient is sitting at the comfort of the home. And telemedicine, teleconsultation can happen, prescription can go, initial tests could be performed, and then patient comes to the doctor and the real operation is performed. So 5G is bridging that gap between the doctor and the patient. Hub and spoke model. So one Apex hospital is there. There are small centers where one senior surgeon can really direct the surgeries, tele-ICU. All these are examples where 5G and AI together are really creating total difference.
Right. So clearly 5G is playing an important role in terms of remote care, remote healthcare. Yeah. I think moving on, Pranav, you and your organization, I think, is really bringing to life the benefits of 5G by bringing in connected ambulances. But there's a whole ecosystem that needs to be created to kind of offer those kind of services. So it's not just seamless connectivity. It's smart devices, it's telemetry machines. How do you bring that ecosystem? If you can maybe throw some insights on how do you practically implement what you do at Medulance?
Absolutely. So I don't know if you guys know, we are an organization in the emergency response space focused around medical transportation, ambulatory care services. Our aim is to ensure that help can be given when it matters the most. And that's the problem we are looking at solving. Over the last 7 years, what we've realized is that technology is very important. We still say that we use technology as an enabler in our services. Back when we started, it was very simple. To say that platforms like Ola and Uber had come in, taken advantage of something as simple as geolocation. Why can't we do it in an industry where time is much more relevant? And then ensuring that creating a network of ambulances, providing a faster response time, creating availability across the country was the first problem we solved. then I would say that working with corporate organizations, commercial residential facilities, and today the government has allowed us to scale, in terms of the kind of services we are running. And then, yes, the advent of technology does come in, and how do you actually use it? So we were the first company to actually launch the 5G smart ambulance. We did this in 2022 at the IMC with the Prime Minister in collaboration with Reliance Jio. The idea that time was very simple. As you all know, time is critical in the industry that we work in. And what we realized was that if within the ambulance, the patient data can be transmitted to a remote location or even the hospital, we can send footage transmissions of the patient again to the doctors at the emergency room. They can give more life-saving instructions to the paramedic. By looking at the real-time patient data, this could be very relevant health information in terms of their ECG, sugar levels, oxygen levels, blood pressure, right? That can be monitored while the patient is in transit. And that was, how we started. It was more of an imagination at that point when we launched, and I would tell you that today we've already ensured that adoption has happened. Today, not only Medulance, via us, the government of Delhi, hospitals like Narayana, Gleneagles, and many more are already using and will start using the 5G smart ambulance. However, I see that the real benefit of the 5G smart ambulance is going to happen in Tier 2 and Tier 3 cities today. Because there the closest possible multi-speciality hospital is about 120 minutes to 180 minutes at times. That's when, if someone is monitoring, and as Sir said that, he's seeing surgeries happen remotely, I'm saying this is something, till the patient reaches the hospital, time is critical, right? And now when the hospital is about 120 minutes away, if the doctor can give life-saving instructions to the paramedic while the patient is in transit, right, it could actually help save a life. And I would say we barely scratched the surface when it comes to adoption. Too much to be done in the space. Of course, the power of 5G or 6G in the future will be realized more and more. I would say it will allow us to create a more robust healthcare ecosystem. If we are able to do it really well, it would help us in bridging maybe the urban-rural divide. It'll make the healthcare services more cost-effective. Can also allow us to scale it and make it more sustainable as well in the future.
Great. I think these are great practical examples of how 5G is being deployed in providing critical care in this golden hour where patients are just stranded traditionally. Yeah, great. Mr. Bhardwaj, we talked about, using the power of 5G, and I think government today is focusing a lot on rural, covering the rural blind spots. Could you share some initiatives around how, something like a simple thing like telemedicine, which has been in existence for quite some time in India, can be now augmented with 5G to extend other types of cares rather than just preliminary investigation?
Okay, in terms of, one part of any problem is providing the connectivity and providing the pathways, and second part is the user base expansion through devices. And 5G has, as he rightly said, he just told that they were launched by the Honorable Prime Minister during IMC 2022, if I heard correctly, 2022, right? So there are many good examples of such applications being developed. Different operators, and this is in the interest of carriers or telecom service providers to create use cases, because that's how they will monetize the investments they have done on the networks. So all of the operators and government together in different places are working in identifying the devices, and thankfully there is a proliferation of, I don't know, not many people are sitting, but many of us have seen the wearables. I just put a dot here and my sugar levels are being monitored day in, day out. And based on that, my doctor is able to remotely see and tell me, not only my own app is able to tell me that, you have perhaps forgotten your pill for the day, or your sugar levels are going high, maybe take half a pill extra. as well as my doctor is able to view my history thanks to the big data analytics at any point of time when he wants, and we can create alerts. So all this is happening. Now the next level is, how does this reach to those people who perhaps today at the income levels where they cannot afford these wearables? That's where the common things come. That, if I had to provide connectivity, we thought of e-chopals, that there'll be one chopal, one computer which will be connected, and people can come and make use. If students have to fill up some forms, they can come at the chopal and fill up. The same way, there are different startups, they are developing remote diagnostic stool, or a platform where you come and sit there, and a doctor sitting in Delhi is able to see your pulse, see your parameters, and ask you to cough harder, or do certain things, and he can then diagnose, create basic diagnosis, take your ECG through the same machine, and the telemedicine which we read 30 years back is actually becomes living. Many of the hospitals, all good hospitals today have remote OPD apps, and people are using them day in, day out. But OPD app is not giving all these sensors. So these stations, or remote patient stations, are providing this, and my secondary and tertiary healthcare is going to get revolutionized. Today one of the biggest problem of rural healthcare is the doctors never reach there. The paramedic is not reaching in time. So we are in a stage where, that inflection point, where all these devices which are available, and you have to just travel to one of the incubation center in Delhi or Mumbai, or in some engineering college, anywhere. And these kids are developing. They are developing prosthetics, they are developing different devices, they are developing these stations. They are adding small parts to these remote diagnostic stations. So that, if you want to do my blood test on the same thing, you put a needle, and that needle will do the sensing. So wearable plus these sensors are getting developed as we talk. As proliferation increases, their cost is going to come down. And what we think of today, in terms of that this is what the technology will do, will become reality very, very soon. That's, today, if you want to buy a potato, and I'm repeating this example, you can pay through UPI, right? So the same thing today we are talking in this forum, or we were talking 2 years back in this forum, and I invite all of you to India Mobile Congress in the mid of October, that is 15 to 18. We will have 1,000 select startups from India, and close to 50 startups from across the world. We are getting a startup from Oxford who have prepared a head wearable. So if somebody is having a migraine, by putting that wearable cap and monitoring you for 7 days, they are able to identify the reasons and what happens in the mind in terms of heat map of the mind. And then that helps the doctors diagnose and give a special pill which will address that part of mind. I mean, even though he's a techie, he knows he will tell you through doctors that for this side there is a different pill or different kind of injectable which is needed, and for this side it is different. So these people are working with doctors and creating these solutions which are, I would say, in the research today, but will become reality very, very fast.
Thank you so much, Mr. Bharadwaj. I think startups are our future, and it's really encouraging for us to know the government's focus on giving startups an opportunity to kind of democratize technology and come up with newer, more innovative use cases. Moving on, Mr. Dwivedi, I think given that you are at the forefront of technology, I'm sure there must be 10 considerations or 10 or more considerations that you may have to kind of consider or find a solution to while deploying any new technologies. For example, AI has a lot of biases. AI is supposed to be, there are a lot of data concerns. How do you, as an organization, balance between tech deployment for becoming future ready, at the same point of time safeguarding your organization from all the threats that are associated with digitization?
No, this is really a great question. So there are certain considerations, and yes, bias is certainly one. So bias is where machine learning and deep learning is involved, and where a professional is sitting by the side of a machine learning algorithm, and that is constantly absorbing what is the behavior of that particular physician. So if you really connect this with one physician, then this bias will be there. So you have to distribute. You have to take multiple, trainers, and in multiple areas, and a lot of samples need to be there. Then only you can, and you need to review when that particular AI algorithm is making a decision. Now there is a board that is reviewing. You must make sure that there is zero false negative. False positive is still okay. That is an irritant. So when a diagnosis is happening and AI says probably it is benign and the cancer has gone through, probably the professional will also tend to agree with AI. And the real danger is रस्सी को सांप समझ लेना फिर भी ठीक है सांप को रस्सी समझ लेना बहुत खतरनाक है so right, so zero negative bias has to be there, enough sample size has to be there, then the technology world, we were at this stage where we used to talk, Hanji, now we are at 5G. So this is the progress that we have made. And we can collaborate different units. We have North Delhi and South Delhi unit. Max had so many, 30, 40 hospitals. They can all collaborate, they can all work together as a consortium, have enough data. For example, we have tissue bank in our hospital. Now all different sorts of tumors are being stored there. Similarly, all these pieces of information that is relevant for diagnosis or treatment, it is being captured, it is being analyzed, it is being corroborated, and then used. One more important aspect that you did not ask, that is about the cyber security. So it has privacy and regulatory considerations. A lot of data that is being captured, and now with the advent of these wearable devices, almost all our data is now online. And I'll give you an example. I was sitting with my son and his family, and we were just having a casual chat. Suddenly, that Alexa woke up. Sorry, I didn't understand. Now you imagine how dangerous this is when Alexa is listening silently to what is all going on. Somebody is snooping into our life. So we need to be very careful about how this data is being gathered, how this data is being stored, processed, analyzed, and decision making is happening.
These are great insights. I think with all digital interventions that we're bringing in, we need to be careful about some of these sensitive aspects around data privacy, security, biases, to make sure that we are using technology to the optimal, but in a safe, secure environment. I think that brings to the last question of this panel. Pranav, would just maybe crystal ball gazing into what do you think is the future of digital healthcare in India, and how can India be at forefront of some of these healthcare innovations?
Absolutely, yeah. I think firstly, as Sir was saying that we've been one of the, if you see how technology is being adopted in India, how UPI came in, and even how India Stack is working, we are the pioneers to develop new technologies. Maybe we were late to the party, but now that we are the first ones to adopt the future first, right? So that's very important. And the other aspect is that I think that especially when it comes to healthcare, the term AI is used very loosely at times, is what I feel. We keep using it. I think whatever we need to do today should enhance patient outcomes. If that is what it leads to, it's all positive, right? If that doesn't happen, there's no point of working towards it. So we need to keep seeing that everything that we are doing, working towards when it comes to technology, especially in healthcare, I'm talking about especially keeping patients at the forefront. Obviously, there are other ways to use technology, that would help us save costs, enhance data. But when it comes to patients, I think the motto should be how we can improve patient outcomes. If that's at the forefront, I think that's what the future should look like.
Lovely. Thank you so much, everyone, today. I think this is really promising. This has been a promising session where 5G can truly be heralded as the future of healthcare, given the endless possibilities that it can do in terms of bridging the gap, the existing doctor gap, the connecting the unconnected in our rural India. I think possibilities are unlimited. And with the visionary government and the support that we're getting from the government and the innovation that is happening in the private sector, I think India clearly will be at the forefront of some of these healthcare innovations. With this, we would like to end this session. Thank you so much again, ETTelecom, for bringing us here together. And thank you, my panelists, for sharing these invaluable insights.